You're listening to Nutrition Matters Podcast with Paige Smathers, registered dietitian nutritionist. Hey everyone, it's Paige, your favorite nutrition podcaster and dietitian. Nutrition Matters Podcast explores what really matters in nutrition and health with a sensitive and realistic approach. This podcast relies on the support of listeners like you and needs donations to keep this project running. To help support the podcast, please consider making a donation at pagesmothersrd.com/podcast. If you find this episode interesting, engaging, or helpful in your life, please consider donating, sharing with friends and family, and leaving a review on iTunes. You can leave a review about this podcast straight from your podcast app. Search Nutrition Matters Podcast, click Reviews, and then write a review. You can also find me on Instagram and Facebook at Paige Smathers RD if you'd like to have a little more food for thought. Thank you for listening. Hi everyone, welcome back to Nutrition Matters Podcast. My name is Paige Smathers and I'm your host, and I'm grateful you're here. I had the best time chatting with Maria Paredes about the similarities between walking away from diet culture and walking away from an abusive relationship. And before you turn off the podcast thinking, oh, well, that doesn't have anything to do with me, I've never been in an abusive relationship, or gosh, that seems really heavy, maybe that'll hit too close to home to me. Maybe if you're having some of these thoughts, I just want you to know that this conversation, I think, is going to be extremely helpful just to be able to normalize the process of what this really looks like, and just kind of unpacking the complexities of making this shift in your life and how similar it is to some of the other really difficult things that we may go through or someone we love might go through in life. So I really think that this episode is a super helpful and going to be a really well received episode about just getting down to the practical elements of what's similar, what stages do we go through, what's normal, what do we look for in ourselves, what do we look for in people we love, and how do we support ourselves and each other through the process. So stay tuned for that. I'm really excited to share that with you. Do want to announce my mindful eating workshop, just in case you haven't heard yet. That is up and running. That is going to be on April 7th in 2018 in Salt Lake City. This is going to be an all-day workshop where I'm teaming up with Noah Rashetta, and we're going to talk about the principles of mindfulness and talk about how we can use those wise principles in our relationship with food and in healing our relationship with our bodies, and engaging in really great self-care in general. So look out for that. Check that out. See if it might be a good fit for you. Even if you're not local, I do have some people who have told me they want to fly out to come do it. So I'm excited about that. That is on Saturday, April 7th, 2018. And then also check out the website. See if you want to learn more about it. See if it might be a good fit. That is mindfuleatingworkshop.com. Or you can access it through my website under pagesmothersrd/workshop. All right. I also want to promote my course because I just am getting the best feedback about it, and people are loving it, and it's so exciting to see the changes people are making. It's so energizing and fun for me. So if you like what we talk about in this podcast, but you're just like, gosh, I need some more ideas, or I need some more steps, or I really need help figuring out how to make this work in my life, and you want to check out the course to see if it might be a good fit for you, I would definitely recommend that. That is pagesmothersrd.com/course, and you can learn more about it there. And I am always more than happy to chat with anybody on the phone if you'd like to see if it's a good fit for you. So please check it out. See if that's something that might fit your needs. And then we'd also love to see you over on the Facebook community that we have for the podcast. So Nutrition Matters Podcast Community on Facebook. And I think that's it, my friends. So with that, let's get into, I just want to quickly introduce Maria to you. Dr. Maria Paredes is a licensed professional counselor, clinical supervisor, and certified eating disorders specialist. And she owns 3 Birds Counseling in Greensboro, North Carolina. She works with women and men who want to make peace with food and their bodies, and she utilizes the health at every size and intuitive eating approaches grounded in relational cultural theory. She's a really big advocate for helping individuals live fuller lives, free from negative thinking, fear of food, and body hate. She believes that all bodies have worth and all individuals deserve to enjoy food, move in ways that feel joyful, and treat their bodies with kindness and gentleness, and experience authentic connection with themselves and others. Maria recognizes that this healing must occur within the individual therapeutic relationship as well as with the larger cultural environment, and thus embraces the role of advocacy and activism. And we talk about that in the podcast episode. Her clients include individuals with disordered eating and body image concerns, anxiety, and infertility and pregnancy loss. And she also teaches courses at UNCG's counseling department and provides clinical supervision and training to new professionals working toward their licensure as therapists. And she's the mom of 3 young girls and really is passionate about the idea of them growing up to experience a world that is free of all these struggles that we talk about on this podcast. And I know that that's a big dream, but that's really where a lot of her passion and excitement for these topics comes from. So this is a really fun conversation, kind of a different look at this whole process of healing your relationship with food, and one that I think you're going to enjoy a lot. So I'm excited for you to sit back and listen. Enjoy. Well, hi, Maria. Welcome to Nutrition Matters podcast, and thanks for being here.
Hi, Paige. Thanks for having me.
So you're welcome, first of all, and let's introduce you a little bit before we dive into this meaty topic we have today. Let's talk about you and what you do and what your training is and where you live and all of that. Just kind of give us the basics.
Sure. I am in Greensboro, North Carolina. I grew up in New York, but I've been down here for over a decade. And I'm a licensed professional counselor and clinical supervisor and a certified eating disorder specialist. And I have a private practice where we specialize in eating disorders and body image and trauma. We also do some work with grief and infertility pregnancy loss, which I think overlap. I just really love doing this work. And I find that it's exciting to watch people become more confident in themselves, live fuller lives. The selfish part of it is I'm in recovery myself, and it's really meaningful to me to see folks be able to access recovery and then just do amazing things and then help others, access it as well. It just continues to ripple.
Yeah. So you're involved with both with the helping to supervise other clinicians and then working one-on-one with individuals in your private practice. And I've also interviewed Melissa Carmona, who's in your practice as well, right? Is that that's
yep,
right?
Melissa.
Okay.
Yeah.
She
does
awesome.
Great work, and she's awesome. And she started out as my student, and it was just very clear in working with her that she was a good fit for the practice. She brings such a neat background and understanding in terms of cultural issues, and then just being able to provide Spanish-speaking services to the community, I think, is so important. And
yes, I love that.
Yeah, I get a lot of calls because my name sounds Latina, and my husband. So my husband is from Mexico and speaks Spanish as his first language, but I understand a lot, but could never counsel in Spanish. So it's nice when people call, because I do get a lot of calls in Spanish, that I can, share Melissa with them.
I can totally see that working to your advantage, like where people think, oh, she'll speak Spanish, and then you're like, well, but yeah. I actually have this other person.
I have this other person, and she's awesome. Yeah, and she also does work in English too, but it's nice that she does the work in Spanish.
Has both of those options. That's so great. Yeah, she's fabulous. So I interviewed her a few episodes ago about her, just for anyone listening, about her experience of being born and raised in Colombia and then moving to the United States. So if you're interested in looking at her or listening to her story, that's episode 84, and she is just fabulous. I'm a huge fan of hers. So definitely recommend people tune into that as well. So Maria, thanks so much for telling us about you and your background and what you do. So let's introduce our topic today. We're going to be talking about how just some of the parallels and similarities between diet culture and abusive relationships, and that seems like a really tricky, heavy subject, and it might end up that way. But let's talk about how this came to be. For what I want to say first is, I reached out to you a few months ago, and we were kind of like, hey, I should have you on the podcast, and we've kind of been going back and forth trying to figure out exactly what topic we would talk about. And then one of the prompts I'd given you in the document I gave you was, what are some of the things that come up most often in session? And this was one of your ideas. And then you just told me this morning that you happened to just hear a podcast about that. So you want to talk about that for a minute and kind of give credit where credit is due?
Definitely. So Carrie Beek and Louise Adams with the All Fired Up podcast talked about just this idea. So looking at diet culture as sort of being an abusive relationship, and what are some of the connections between the two. And when I heard the podcast, I was going, yes, this is awesome. This is what I talk about all the time. And then there was a little bit of me like, oh no, they got to it first. But I'm able to put that part aside because they did such a good job. And they really, I think, dove deep into how many characteristics of diet culture really match an abusive relationship, particularly in terms of the impact on individuals' ability to get support, to trust themselves, to find their voice, to access help and all that. So so much credit to them. They really did a great job.
So I'm not a super competitive person in this world. I kind of think the more the merrier, and I'm all about trying to give people great resources. So like just FYI, I'll post that link. People can listen to that podcast as well. I haven't heard it. I actually don't really listen to podcasts in this realm. It's a little bit much for me since I have to listen to so much of it myself with what I do, but that's great to know. And I'm more than happy to connect people to that resource as well. So
yeah, they did a really great job, and I think provided some really good resources for people to connect with it. And I've given it to clients too, because I think,
awesome.
It's, I think sometimes because diet culture is so pervasive, and this is not so dissimilar to some of the, I think, sexism that is being talked about right now, just in the sort of socio-political atmosphere. When something is so pervasive, sometimes it's easy to feel paranoid about your own experience and to feel like it's normal. And so naming that and naming how harmful diet culture can be, I think is really important, so that people can start to feel like, this doesn't feel right, and I can trust that feeling.
Oh, I love that. Oh, that's such an important point about kind of honoring that intuition you might have about, wait, there's something not right about this, and not normalizing that, right. Encouraging people to listen and honor that.
Right. Yeah. I mean, some of the conversations that you might have heard around the Me Too stuff recently, I've heard people say, well, why didn't people speak up before? Or I can't believe this was all happening. And then I think for a lot of people, especially I think for a lot of women, I think for a lot of people of any kind of marginalized identity, the response is, this has just always been how it's been, and we've just had to deal with it. And so now some people are being kind of awoken to some of the realities that people face, but it's not something that's new. It's something that's been there for a long time. So naming a lot of these things, whether it's, how harmful diet culture can be, or how harmful sexism can be, or white supremacy, or any kind of oppressive force, I think is a really key part of helping people become unoppressed.
For sure. And that's the aim of what we're trying to do here is name it, talk about it, discuss it, provide a bit of an exploration into this idea that then hopefully can help people navigate their way wherever they are on their journey with this. Does that sound fair to you?
Totally.
Okay, awesome. Let's get into it. So,
right.
We're going to kind of shoot from the hip here, for lack of a better term, because this topic, I'm not an expert on this topic, so I'm going to be just sort of trying to dig in and learn from you. So I'm hoping I ask the right questions, but there's a chance that I might be off on some of the things I say here. So correct me if I do any of that. But talk about sort of broad picture, what comes up for you in session with clients when this theme comes up, and how do you talk about it, and what typically brings it on? How do you talk about it at a surface level? I know that's a lot of questions, but I'm just looking for kind of broad strokes here.
Sure. Well, I think it might be helpful to to describe a little bit about what happens in, let's say, domestic violence relationships, abusive relationships. So, when someone is in a domestic violence, abusive relationship, it's never their fault. That's number one, right? And I think there's some really good links that we can take over to diet culture, right? So if someone has had an eating disorder, or if they have been sort of wrapped up in diet culture in whatever way, we really want to sort of stay away from the idea that it's been their fault. And I hear that from a lot of clients, whether in group or in individual counseling, when they do start to learn about health at every size, or learn about whatever, fat positivity, body positivity, sometimes there'll be this sort of insight around like, I can't believe I did this to myself. Like, I wasted all this time, and it's still kind of in this blaming themselves sort of way.
Oh, I see that a ton. There are a lot of anger. Like, I've been doing the quote unquote wrong thing,
right,
all these years with dieting.
Yeah. And so I think one of the wonderful things we can do, whether we're working with someone who's in an abusive relationship or someone who is trying to leave diet culture, is just taking away some of that blame and shame. So it's not really about, something that the victim or the survivor did wrong or did to sort of attract the abuse. Right. They, in the same way, like if someone is raped, there's nothing they did wrong to attract the rape, whether they were wearing this or wearing that, whether they were going a certain place or not. It's never the person's fault who is the receiver of the abuse. So when someone's in an abusive relationship, that there's a lot of things that they experience. Isolation. It's the person who's perpetrating the abuse is a very good manipulator, can really cause the person to feel like, the abuser is the only person that they can trust, which I think is like diet culture, right? You have to do this diet, you have to lose weight to be good. And that's just not true. For many reasons. And it can isolate people away from others. It also isolates them away from themselves, because when someone's in an abusive relationship, they start to lose a sense of their own voice and to distrust their voice. I think in big part because they're being told that they can't trust their needs, their wants, their feelings, their reactions. So all of this, and I'm really summarizing a lot. I think if, like we said before, if you want to really go in depth to see how they connect, that podcast really did a good job. The piece that I thought would be really neat to dive into is how hard it can be to leave an abusive relationship. And the statistic that's out there that is talked about so often is that it takes on average someone 7 times to leave an abusive relationship before they're able to leave it completely. And so, when I have worked with abuse victims in the past, were present, that's always in my mind of, this person may go back to the relationship. And so I want to be really careful and thoughtful about how I'm supporting them, because if they, if they leave the abuser, and I, as the therapist, is like, yeah, he's such a jerk, and this is the right thing, and you should totally leave him. And then they go back to that person. They may not feel safe coming to me and accessing support. They may feel some shame that they return to the relationship. And so I'm always aware and thinking like, I really want to make sure to support them and their decisions, even if sometimes the decisions are not what maybe I think they should do.
And I bet that gets really tricky in the world of social media, because your clients might follow you and know that you have certain opinions about dieting, and it might be one way in session and another how they're seeing you portray, like sort of more that activist side, right? Because to me, there's a big difference in sometimes in how you support an individual versus how you talk in a large group setting or in a podcast, right? Where you're like, I might have someone over here on this side of the spectrum listening to the podcast. I might have someone over here, someone with that experience, someone with that experience, versus when you're sitting with an individual, you can kind of, I don't know what the right word is, be a bit more soft and supportive and kind of open to where they are. Does that resonate with you?
Absolutely. And I don't want to ever moralize anyone's decisions or life choices, whatever they might be. And And I'm sure that you've heard this before too. I've had a lot of clients who will, sort of apologetically tell me, oh, I started a new diet, or, like, I still want to lose weight. Is that bad? And, I never think that's bad to have those feelings. I think it's helpful to explore what they're rooted in, and what the function of those feelings or thoughts or behaviors are. But, I don't want to be the moral police of anything, telling someone you should do this or don't do this with your body.
I think I think that's a really good distinction. And I actually just released a recent episode about this, where it's like, you don't want to just be completely black and white in this world either, right? Because you run into some big issues there too. So, but it is tricky because, for those of us who are trying to kind of, like you and me both here, we're trying to put our voice out there. We're trying to be, show that this isn't perhaps a route that leads to a lot of peace and that's helpful, but at the same time being able to be compassionate, understanding, and supportive when someone's in their own place with all of this. It's a tricky balance.
Yeah. And I think meeting people where they are, so going back to the idea of the metaphor of the abusive relationship, I remember there was a college student I worked with. This is many, many years ago. And so, like, I say that as, like, I think I was still learning a lot. And I mean, I still am learning a lot. Hopefully we'll continue learning. But, she was in an abusive relationship, physically abusive relationship, and had, I don't remember all the details, but had, I think, like, told me she left the person or whatever it was. Then, like, 2 days after a session, I, like, saw her on campus driving with the abuser, and then maybe I saw her and she, like, didn't tell me, that they were back together. And it was just great insight to see, like, this is complicated. And again, it's never the person's fault, but there are a lot of complicating factors why people return to abusive relationships. So we don't want to jump too quickly to judge it or to push, certain dictates on them about, like, what's right and what's wrong. And there are some stages that can be helpful to explore too, like stages for leaving domestic violence relationships. I
definitely want to go there, but I want to ask a question first. So just in regards to what you were just saying about it, the research shows that it takes on average about 7 times before someone really cuts that tie. I know this is totally anecdotal. I do talk to a lot of people about this all the time, but I actually think that seems fairly consistent with what I see with dieting too. I wonder if there's some similar numbers there, just because part of what I'm doing in my first appointment, my first assessment with my new clients, is trying to kind of understand where they are on that continuum, and kind of trying to understand, are they in this place where they're like, I 100% know that I can never, ever, ever go on another diet ever again. I have to admit, I get a little excited when people are in that place, because it's like, okay, good. Like, we're not going to have to do this back and forth dance, But yeah, there are people who come in and, maybe when they're giving their history, they're explaining, okay, well, I just a few months ago, I tried this and it didn't work. And I'm looking for you to kind of give me the next one, even though I try really hard to make sure people know all over my website that that's not really what I'm about. But I guess I'm just trying to sort of apply this to the listener, maybe trying to take a look at, like, where are you with all of this? Like, have you gotten to that point where you're like, no, never again? Or are you still kind of dabbling? And maybe, I don't know what we can take from that other than maybe just kind of recognizing that this is really complicated to cut
totally
yourself away from. Yeah.
Well, and, one of my favorite questions on my intake form is, I have, like, the general kind of intake questions about history and all that, but I have a question that is phrased something about, when is the last time you felt connected to your body? And I think it provides such helpful information because, a client answering that saying, I never have, or when I was 10 and they're 40 something, or 2 weeks ago, like, I want to know more about that. Do you often feel connected to your body? Do you not ever remember ever feeling that? And I think that kind of goes along with this idea. People are at such different places when they start this process. And I don't find that it's generally a linear process either. I think that sometimes too, signs of progress even include going back to old behaviors, but in new kind of ways of almost experiencing them and exploring them in new and different ways. And that actually aligns with these stages of leaving abusive relationships too. So we can make some links there too.
Talk about that more. I actually really love that, because I think one of the big things we're doing, you and I, in our work, is trying to help people reframe these experiences where they're like, oh, I had a setback, or I'm a failure, or I messed up, and this really resonates with me. So I want to hear you talk more about that.
Totally. Yeah. I'll tell the stages, but what you just said made me think of even being in my own recovery process. I remember working with a therapist I worked with for a long time, and, at different points having gone back to eating disorder behaviors and going into a session with her expecting for her to sort of wag her finger at me or be disappointed. And one of the most healing things was for her to approach it in almost the same identical way as she'd approached any other progress, which was encouraging me to be curious, to notice, to explore it, to sort of own it. And in doing that, then I was able to really get richer information and then keep working on recovery. So the stages, the first and second one of leaving an abusive relationship, and this is based in someone named Lyndall Caw's dissertation. And so the first and second stages are really about starting to not care for the abuser anymore. So starting to disconnect emotionally from the abusive relationship. And so I think about that with diet culture. I think when people start to be curious, because I'm sure you've seen some people, or maybe can think of friends or family who are completely not curious at all. They're fully bought into diet culture, and they're not even entertaining the idea that there could be anything else. Totally. Exactly. Yeah. So, stages of change. Yeah. Because I think this is similar to that. So yeah, pre-contemplative, don't even see that there's any problem. So the first and second stage of leaving an abusive relationship is just starting to not care for the abuser. I hate these diets, or, I don't care for them. I don't do them, and starting to disconnect emotionally. The third stage is starting.
What's the first and second? Because I'm just hearing one, disconnect emotionally.
Yeah, to be honest, I don't know the separation between the first and second stages, because most of the times when they're talked about, they lump those two together.
Gotcha. Okay.
And so
I would make sure I was following.
Yes. And I would guess, if I had to guess, just because a lot of these kind of stages, like the stages of change, I bet that the separation is more in just sort of maybe just starting to notice things and starting to maybe even consider that there's even an issue, similar again to stages of change.
Awareness maybe, or something.
Yeah. Exactly. So then the third stage starts to notice the effects of the abuse. So where you think first and second stages, it's more just kind of starting to disconnect. Now in the third stage, you're starting to go, oh, there's actually maybe some downsides. There's some negative effects of this abuse. And then you start to make the preparations to leave. So if you're familiar with stages of change, that's also starting to get into the preparation stage, right? The fourth stage, and I should say, included in the third stage, they even talk about leaving too. So it might even be in that stage where you're making either preparations to leave or you actually leave. And that can look really different in domestic violence relationships. Sometimes it's just, quote unquote, leaving and staying a night at a friend or family member's, but maybe not making any kind of financial separation or legal separation. Those leaving events can be on a spectrum in terms of what that actually involved, right?
So kinda then dabbling in it and then maybe going back, but kind of going, trying things out, experimenting a little bit.
Yeah.
Sort of like we do. I mean, I want to dive into the similarities here, but let's hear them first. Is that kind of what you're thinking? Okay.
Yeah. And I know this is a lot of information. So the fourth stage is going back to the relationship. So, which I think is so important to even have its own stage, that in some ways it almost normalizes that is often part of the process. Not that we're encouraging that, but that I would say as providers to almost expect that, because I think it's really normal if you have been in an abusive relationship and had those that manipulation, performed on you, it's going to be really hard to disentangle. And it's not going to be this like clear one-time complete break. Often there are many sort of smaller breaks before the full break away from the relationship.
Well, and I think that's important for providers to know, but also important for people who are going through this to know too, just to be able to recognize, again, that that's not a sign that you're a completely terrible person, like you might be trying to tell yourself.
Yeah. Yeah. And I mean, I think certainly like, in the back of our head as providers, I would like to reduce the number of times someone goes back, whether to abuse, whether it's in a relationship or whether it's a diet culture. But, we may not be able to do that. So more than thinking about stopping it, it's how can we provide support and information and support their curiosity so that when they are ready, they will really be in the place they need to be to leave. And that's stage 5, is actually leaving an abusive relationship.
Okay.
For good.
And that's the end. Or
yeah,
what?
That's the end. And, I think we all know, like in life, things are complicated, right? So, we could add in like someone who's in an abusive relationship and there's kids. They may not be able to completely end, contact. I mean, there's a lot of different factors here. So I don't know that anything's ever fully finite. Sometimes they are and need to be, but, I think life is complicated. And I think that applies here with diet culture as well. I've talked about this before. I know this is controversial, but I am one who tends to not like this whole idea of, yes, you can completely be recovered from an eating disorder. I don't know if you've heard the debate, like recovery, being in recovery versus recovered. And I tend to think that, it's hard to ever achieve full recovery because we live in diet culture.
That's exactly where I was going with that. So you might leave it, but you still are forced to exist with it, right?
Right.
This is a big thing that comes up every year during the holidays for people is like, okay, I'm in a good place or I've learned a lot, but you guys sure haven't. And I have to deal with all the stuff you say. And that's maybe holidays, but that's just also just life. That's work. That's socializing. That's, lots of different situations.
Totally. Like if we could take our clients and put them on Mars where all bodies are respected and there was no diet culture, then maybe full recovery would be possible, but we can't do that. And also I think so much of this is about power. I think the concept of full recovery sometimes ends up hurting most people who are more marginalized, like people of color, because it's not as accessible. So sometimes when I hear folks sort of pushing that idea, I think, it may leave out some groups of people. And, can we really talk about full recovery when not everyone has the same rights? Or, can we really talk about full recovery when some parts of our population are still criminalized or jailed, at higher rates than other parts of our population? Does that make sense where I'm going with that?
Yeah. And what brings to mind for me, as with so many of these debates, I don't know if this is a good point or not, but to me, it's kind of like whatever works for a person individually, like if they need, if it's helpful for a person to say, yes, full recovery is where I am and I'm solid in that. Great. But maybe not pronouncing that on others and allowing others to experience their own process in their own way seems like a fair way to approach it.
Totally. And, and I think everyone's story and experience is so unique and different. And for some folks who have experienced tremendous abuse and neglect in multiple ways, pushing this idea that they can somehow, completely get to a place where they have no issues around food and body at all, sometimes I think ends up causing more shame for them. Like, am I a failure that I can't fully leave some of this behind? And I see that a lot with binge eating disorder, where some people sort of look at recovery from binge eating disorder as having no more binging at all. And I don't think that's the case. I think recovery from binge eating disorder sometimes means that there still is binging, but that there's so much less shame around it, and that there's more listening to body cues and more enjoyment around food. But we may not fully get rid of all the binges.
I think that does get very messy when we put labels on it that are intended to sort of be a concept, a theory, an idea to aim toward, but where it sort of sets us up for, well, when I fall short of that, because we all do, then
Right.
then we run into more problematic behaviors from the shame that you feel about falling short. So yeah, I think it's always this cost benefit. It's like, does this label help me? Does it harm me? Does it take me where I want to go? Does it make it easier for me to practice self-care? Does it make it harder? I mean, that looks different for different people.
Totally. I've had clients who, their loved ones or their spouse, like the client is working on recovery and doing all sorts of things to sort of embrace their body and heal their relationship, but their loved ones might be still very steeped in that. And sometimes I've seen situations where it's almost come down to a choice between doing that work and maintaining their relationship. And that's a tricky one. Am I going to say choose haste, choose this work over your marriage or your relationship with this loved one? I think there's just a lot of complicating factors in people's lives, and often I think people are just doing the best they can. So as a provider, I think, how can we support that so that they can both maintain relationships and whatever that means, and maybe access some more healing and just opportunities to experience their body in different ways.
Yeah, that's beautiful. All right. So what I'm thinking, Maria, is let's look at those stages you just listed.
Okay.
And let's draw the parallels for people and kind of discuss each one individually. Because like you mentioned, the podcast we talked about in the beginning does a great job at drawing the similarities of why leaving diet culture and leaving an abusive relationship, why that's similar. But then what we're going to talk, or what's similar about those two processes. But then we're going to talk about the stages. Is there a differentiation that we need to do here? Because I had started writing a list of similarities between dieting and abusive relationships, but that's maybe what that podcast covered, and we're going to cover the stages of leaving. Is that fair?
Sure. Yeah, and maybe how to work with or support people when they're in that process of trying to leave. Beautiful. Yeah, sounds good.
Okay. So stages 1 and 2 you mentioned are basically summed up by saying disconnecting emotionally. I'm really intrigued by this idea. What kind of comes to mind for you right offhand? I mean, totally makes sense in context of an abusive relationship, because it's very hard to even contemplate leaving when you're connected emotionally to that person who's harming you. So yeah, even just hearing myself say that out loud, I'm like, wow, I can see how that would be so true with dieting. But what else comes to mind for you?
Yeah, and I think I'm as I'm talking, I'm pulling up stuff. I think stage 1 is when the abuse is happening, and the person is more or less aware of that it's even abuse. So the person's more entangled in it, and I think in some ways, when that person's in it, I think a lot of it seems so normal, right? Like it's just what you do. And so I think of, for diet culture, like people who are like, oh, well, I'm laughing. I'm thinking of loved ones who are like, well, I don't have an eating disorder. I'm not whatever. I'm just trying to watch my weight, or I'm just trying to, maintain my size, and so there's almost a lack of awareness of the connection maybe between how restriction is sort of keeping them in that abusive state.
Totally. And all the people around them are doing it, and there's no reason to even question whether or not it's a thing to do, because it's just what you do.
Yeah, they don't think they don't think they have an issue. They don't think there is any abuse that they're experiencing.
Totally. And maybe they look at other people and they say, oh, well, yeah, well, gosh, of course she has a problem. She's taking it too far, but I'm fine because I'm just engaging in this or that behavior, but she's doing this. And there can be maybe an awareness of other people. It's easier to see it in other people, but maybe harder to see it in yourself at that stage too. And that seems to have lots of parallels to me.
Totally. one of the things I so appreciate about doing this work is, the folks I work with generally are some of the most compassionate, loving, empathetic individuals out there for other people, but they have a hard time applying that to themselves. And I think sometimes the work is helping them sort of use those same skills that they have in providing that compassion and acceptance to others, being able to apply it to themselves.
Yes, that's a great point. Okay, so stage 2, disconnecting emotionally. What do you think that looks like?
Yeah, I think during that stages, and I'm curious. I kind of want to go back and see if they had even used the stages of change as part of their developing these stages, because there definitely is, as we talked about before, similar. There's definitely some similarities. But I think starting to see awareness, starting to maybe disconnect from even the sort of dance of abuse, so to speak. So I think sometimes when an abusive relationship is happening, you, just like in any relationship with any kind of dynamic, the dynamic almost takes over. This is just how we interact. This is just how we do things. And so, I think in stage 2 is where people are starting to kind of disconnect from that dance, or maybe even doing it, but disconnecting from being fully present in it. Okay, I'm dieting still, or I'm doing this, but this, it's maybe not bring the same charge, or it's not feeling as motivating, or, it just doesn't feel like it has a purpose as much as maybe it used to.
Yeah, those are all great points. I think in order to understand what it looks like to disconnect from it, you have to understand what it looks like to be emotionally connected to dieting, right? So to be emotionally connected to dieting, you tie all of so many of the things that you want and need as a human being to a body size or to a certain way of eating, or your identity is wrapped up in this is who I am, this is how I eat, this is how I move my body. And I think part of the process of disconnecting emotionally could be taking a look at wait, who am I without this? What makes me me? And that's really hard work. And I know a lot of people who are in the throes of that right now that I work with, and it's a big question. It's a huge question mark. I don't know. I don't know who I am if I'm not.
Paige, I am right
girl.
with you.
Yeah.
Yeah, totally. Well, I think what you're sort of naming is that when people start engaging that process of exploration, it's really deep existential work.
Totally.
So kind of like I said before, a lot of these people I work with are such deep, compassionate, thoughtful individuals. And, when we explore sort of what do you believe about life and about people who are good, and what the purpose is, they have these deep, meaningful, existential understandings of the world. And so then when we try and kind of make connections of well, how does that fit then? If what's important to you is A, B, and C, doing these good works or whatever it is, how does spending all this time on trying to be smaller align with that? And I think for a lot of folks, when they're able to kind of lay those things out, they start to see it doesn't really align. I don't really care about appearance, but I'm spending all this time and energy putting into appearance. So I think that's great. If you can get at that existential, meaning of life, purpose of life stuff, I think you're doing some really good work.
And detangle your identity from your food choices. I loved when I chatted with Emily Fonsbeck recently. We talked about how health is supposed to be a means to be able to live life, not the absolute purpose of why we're on this earth. And it's so easy to get caught up in that because it's kind of a fun, trendy. I mean, I don't think it's very fun, but for people, it's fun and whatever, they can get into it, and it kind of seems like a hobby. But I think taking a step back and being well, wait a minute, what is important to me? Who am I? What do I want to be doing with my time and energy? I think it's great to look at these as stages and be first you do this, then you do that. But really, in reality, it's probably you're trying to kind of do all of this continually, right? And maybe you make a realization at one point, and then you're oh, I figured out that I don't need to have my identity wrapped up in being the healthy person. But then, a few years down the road, you're like, well, maybe I need to start really discovering who I am. It's kind of, I think, a process. So don't get caught up in like, okay, check off step one.
Right.
I have become, I'm entangled in abuse and I'm unaware. Okay, check that off. Now it's step two. That's not kind of what this looks like.
But I think you're right. Like in some ways that is, I think one of the harder parts of this work is really going, okay, like who am I separate from this? And I think this is where, you see I think a lot of folks when they're working with eating disorders, the age that you're often seeing it at is college age. And there's so much self-exploration, identity work being done at that stage where folks are sort of starting to leave how their identity was defined kind of by their family and what they sort of just adopted because, I think this because mom and dad think this, but they're not really in a place yet where they know themselves and who they are yet. And so I think it's almost easier at that stage to let in diet culture to define them because they're sort of this blank, open, vulnerable state. And so it's like, okay, well, I guess I'll identify with diet culture. This is what everyone else is doing. And, I find it really interesting when we can get in there and go, wait a second, like that's not the only option. There's so many other ways. There's so many other things to discuss, to explore, to identify with. You don't have to just do what everyone else is doing at this stage.
So I have so many thoughts about that. And I actually presented on the idea that like our increasingly secular society, we can measure that. We're becoming more secular. I have a theory, and a lot of other people do too, that it seems like dieting can kind of almost fill that like religious kind of need for the things that religion does really well, like community, and gives you meaning and purpose and gives you kind of some ideas of what to do and what to not do. And dieting fills so many of those blanks. And the more I looked into that and researched that, the more I was just like, my mouth was just wide open, like, wow, this is amazing. There's so many similarities. So definitely true that these issues can kind of creep in at certain times of life. But then also I want to be mindful of anyone who's listening who might be in a different stage of life and feeling like, I'm 60 and I'm struggling with this and I still don't really know who I am outside of this. I mean, that adds another layer of difficulty and potentially shame and guilt and all of that. This is all such tricky stuff.
Oh, yeah. Well, and I think what you're bringing up even there, too, is we're seeing the rise of eating disorders in elderly populations. And, I think in a similar way that I love that idea that you said, like we're social beings, right? Like we're all seeking connection to something beyond ourselves, whether it's other people or whether it's some sort of belief system. And when we don't have that filled in some ways, we're going to seek to find it somewhere. So I think about like folks once they retire or once their kids are sort of grown and leave, like in some ways you almost become more vulnerable to this shiny new way of thinking, like diet culture, may not be completely new, but I think you become more susceptible to kind of dive into that and start to embody that as your identity.
And it's extra tricky because it can be so wrapped up in so many great things. It can be kind of wrapped up in shiny in terms of like it looks on the outside like it's a good thing, but it can easily take you down a path that's not really healthy for you or healthy mentally, physically, all of that. Okay, so let's talk about the third one you mentioned where you said that this stage is where you start to notice the effects of the abuse. You start to maybe make some preparations for leaving. So,
or might actually leave. Like that may also be like, or, again, like leave in quotes because there's so many leaving moments, but yeah. Yeah.
So what does this bring up for you with dieting?
Well, I think about folks that like seek me out. We work a few sessions, and then they drop off, and maybe they show back up like a year later, or folks who are like exploring this idea, but then it just takes them maybe more tries, before really coming back and digging in and doing the work. Or just clients who are, they're doing the work, they're there every week, but they have periods where they start to doubt the work, like, what am I even doing? Am I even getting better? Like, this feels hopeless. Am I always going to feel like this? And I love trying to help them reframe that as a normal part of the process of, and in some ways it's almost like the brain is trying to recalibrate and make new connections about some of those behaviors or some of those ways of thinking that are so different from maybe how it thought before.
Yeah, something that comes to mind for me with this too is so often in recovery from an eating disorder, and not everybody listening identifies with that, but just for your information, this is really fascinating to me. Let's just take anorexia nervosa, for example. Like if you all of a sudden are, finally nourishing your body and giving it what it needs, it's not necessarily going to feel really great. You're starting to notice some of those. You're leaving diet culture, but you're noticing some of the effects of what that has done to your body, and your body's trying to kind of get back on track with how it metabolizes your nutrients. And I don't mean that in a weight-focused way, just in like the way your GI tract works and the way your body feels and the way your belly feels and the way food moves through you. So there can be some real hurdles to get through, even when you've started down that direction that's definitely in the right direction. You can start noticing these roadblocks of, okay, now I have GI problems, or for somebody else who doesn't identify with struggling with an eating disorder, but maybe has struggled with their relationship with food in general. A lot of times what I see is, I thought this was a food problem. I thought that this was all about like, I need to, balance my plate a bit more, quote unquote, or I need to, work on my nutrition. That's why I sought you out. But now as we uncover some of this stuff, oh my gosh, there's deeper work that needs to be done. Right. Now I'm noticing, like all the places in my life that this connects and this touches, and I need to, go seek out a therapist or someone with your expertise to be able to talk some of that stuff. Well,
growth is like hard, that deep thoughts from Maria. Growth is hard. But it is. And, I sometimes think, and the metaphor like I'll use with folks, have you seen like a kid, like usually like prepubescent, where they have some sort of growth spurt, but it's like in one part of their body, and like it sort of looks almost incongruent with the rest of their body. Like, yes, their legs grew, but their torso hasn't yet, or their feet are all of a sudden massive, but they're not really as tall to fit the feet. And when they're in that stage, like they kind of look awkward, they're like moving around, like they can't really get their body to work in the same way, because their body's really, I think, adjusting to that growth. And in some ways, I think that's kind of like what you just described, like when we hit these growth parts. And I see this sometimes for folks who maybe do have a history of anorexia and are needing to gain weight. Although I'll preface that I definitely have folks who have anorexia who do not need to gain weight, but who just need to stop restricting, because we see anorexia in folks in larger sizes as well.
That's an important thing to say.
But the folks who are lower weight, needing to gain weight, anorexic, as they start getting bigger and having to buy new clothes, I often see like this sort of process of sort of filling out a size, and them talking about feeling really uncomfortable in their body and like feeling tight in the jeans, but also metaphorically feeling sort of like they're hitting their boundaries. And a lot of times some of the work we do around that is like, this is a sign that you're really doing some great work, sort of metaphorically. You're about to expand, like your brain's about to make more connections. You're about to grow bigger, maybe both physically, but also in all these other symbolic ways. You're taking up more space with your voice, with your thoughts, with your connections about things. And I think helping support people through that process and not minimizing that it's uncomfortable. It is really uncomfortable. Growth is really hard. The eating, disorder recovery is not easy. And I think it's really worth it.
Love that. And this really segues well into the next stage where, it's freaking hard. And that's why it's normal and part of the process to go back.
Totally. Mm-hmm. I am thinking of a couple folks recently who even, named, they're like, but I'm having behaviors come back that I haven't done in years, and sort of being surprised by that. And I think there's so many places we can go with this, but in some ways we were sort of exploring it as they're making more space for themselves. They're exploring things in new ways, and so it's almost like they're creating more space for old traumas or issues or hurts to resurface and finally actually be healed. Because I think a lot of times there are traumas that weren't really healed in the way they needed to. They scarred over, or there was like a Band-Aid placed on this big wound, but the real healing wasn't done. And so sometimes, in the process of recovery, we kind of have to go back, which looks like going backwards, but in fact is still progress.
I totally agree. And I always tell my clients when they come in and one of my first questions for a follow-up is how did things go? How have you been? How's your week been, or your month, or however long it's been? And I can sometimes tell with the body language, like, it's been a really hard week or hard month. And, I'm not excited when my clients are having a hard time. Like, I don't mean it to sound that way, but I always try to help them understand, like, look, if you came back and you were like, this is so easy, I'm just doing it day in, day out, no problems, like no observations, nothing to say. Like, what would we talk about, right? Like, what would we learn? I really am drawn to this idea that pain is what teaches us,
Oh, yeah.
And it makes so much sense from an evolutionary perspective. Like, we learn and we think about and we learn from the situations that cause us pain, because it's totally protective from an evolutionary perspective. So yeah, like when a client comes in and says that, gives that report, I'm always like, okay, let's dive into it. Let's look at what we can glean from these experiences. It's not a failure. It's actually giving us something to work on and talk about and discuss and explore together.
Totally. I'm thinking of many times where a client has come in, and whether it's like, I started Weight Watchers again, or whether it's, I purged again this weekend, and times where they'll come in and report that, and they've been like active in their recovery. It's been a while since they've maybe done any of those behaviors, and they'll come in sort of sharing that, thinking like, that we're going to be disappointed in them. And in exploring it, what I think is really neat is like, so what'd you notice? They're like, well, it didn't really work in the same ways it used to. The purging didn't give me the same response that it always did. And it's almost like this light bulb that they couldn't have accessed otherwise, that if they hadn't gone back and tried that behavior again, they may not have made the same level of connection that, oh, I'm in a different place, and those things aren't working the same ways. I maybe have different needs now, and maybe have other ways of getting those needs met.
That's such a good point. And that's where we come back to this idea of noticing things, being curious, being aware, and just non-judgmental with yourself.
Totally.
I mean, I know that's like so good in theory, so hard in reality, but I think it's sort of a good mantra to keep in mind. This is, if you can develop a bit of curiosity around these things, you can learn so much about yourself and about what's right for you.
Totally. And, I know I mentioned earlier, like something I wanted to bring up that I think ties so much into this, especially around this stage, because it is hard watching someone go back to an abusive relationship. It really is. Like, I don't want to sort of gloss over that. Yeah. I've seen that a number of times, and it feels painful sometimes, because you want that person to not be experiencing abuse, but also trying to remind ourselves that it's not our job to make those decisions for them. There's certain things, like if someone is unsafe, if there's children involved and there's unsafety, like there's certain things as a therapist I have to do. But in terms of re-entering in a relationship that's toxic or abusive, it's not necessarily my, job to do that. But this ties in where I think it ties into health, is that in dieting, health is not a moral obligation. We're not morally obligated to be healthy. And I think sometimes that is often pushed on people, that that there's some sort of moral obligation for them to pursue health, and to pursue health in a very rigidly defined way. And I don't believe personally that we are obligated to be healthy. And I think that's a really restrictive way of looking at it.
Yeah, I think that's an important point, and a really interesting thing to kind of ponder individually about, like, what does that look like for you, and what happens when it's not a moral obligation and it just is what it is. Sometimes there's some clarity when you can separate it from all the morality and just say, like, well, what feels good to me? What seems
Sure, yeah,
like what I want to do? And
right.
it's really interesting, and I think I have a little bit of an angle here just because I'm a dietitian and that's where I'm trained. But I think sometimes when we allow it to not be such a moral obligation, we can really connect with it so much better. Like the true meaning of what does healthy really mean? It's not just about what you put in your mouth. That's for dang sure.
Right.
So.
Right. Well, and it's not unidimensional. Like, it's not like I either have health or I don't have health.
Totally.
Like, there's lots of different aspects to health. And some people I know are like the quote unquote, the healthiest folks I know in terms of their physical prowess and ability to do certain things, but they have a really unhealthy marriage, or they have a really unhealthy relationship to work, and so whereas other people might be unhealthy in these spheres and really healthy in those. So
that's so true.
Yeah. But
No, that's, you go ahead.
Oh, I'm sorry.
No, it's good.
I love talking to you, Paige. This is so fun.
I'm loving this too. I'm learning a lot.
Yeah. I think too, like with health stuff, like I think about veterans coming back from war, right? Like, the example I was going to use is like, I personally, cigarette smoke makes me feel kind of sick, and I will often get migraines if I'm around like a lot of cigarette smoke, right? So I personally don't want to engage with it, but I don't want to police someone else not being able to do that, right? So I have, thinking of veterans I've worked with who have come back, they've had tremendous trauma, PTSD. They're doing such courageous, brave work on trying to heal and access, better mental health. Do I want to judge them or police them around, like, no, you shouldn't smoke cigarettes. Like, if that's what helps them get by or get through. And I think about people who maybe don't have access to other kinds of health or medication, but they can maybe access, tobacco. If that's a way that they're able to, quote unquote, treat whatever their life experience is, and life is hard, who am I or you or someone else to say this is the right way to treat and this is the wrong way to treat
and
what your human experience is? No, you don't ever know.
I work with a lot of people in recovery from substance abuse, and so many people in that population also find themselves smoking a lot, and it's actually helped me to understand why a person might find themselves or might be in that situation where they're smoking. And like, I used to kind of just be like, why would anyone do that with all we know about it? Kind of this like naive view of all of it. But yeah, like expanding your brain and just saying, I don't know what their story is. I don't know what that is serving or what purpose that's serving for them. And I don't need to occupy my precious time and energy with like judgment around that,
Totally. Well, and even the idea that we have to rationalize it, right? Like how we talk about fat people sometimes, like, well, as long as they're working on it, or as long as they have this condition, like, well, they have PCOS, so it's okay. Well, what if they are fat just because they really like to eat? What if that was what it was? Like, why is that so morally wrong? Like, why do we have to justify the way anyone is or what anyone's decision or behavior or health is?
Yeah, it's true. It's so countercultural to think that way, but it really does. I think it's important work that each of us can kind of look at in ourselves and try to see where we might be able to do a little bit better with that. But yeah, it's definitely not easy. Let's talk about this fifth stage.
Okay.
Actually leaving, and we kind of mentioned this as we were listing out the stages there, but what comes to mind for me? Oh, let's hear what comes to mind for you first, and then maybe I'll chime in if I want or if I feel like I need to.
Yeah, I mean, like with any of these stages, and I thought you had some really great points earlier of like, with any kind of stage model, I don't think we ever go through in this linear process. We recycle through stages, we go back. Sometimes we don't go through a certain stage. But with this fifth one, in terms of actually leaving an abusive relationship, I think that's really complicated by the fact that our culture is so disordered in terms of dieting and food and body stuff. So like, can someone fully leave? Like if diet culture is the other part of the relationship and we live in it, can we ever fully leave it? That's probably pretty hard. That being said, I think we can find a lot of ways to leave it, like a lot of, so finding community. I mean, you and I are on some common communities in terms of the health at every size world. And I think it's been so incredible personally for me to connect with other people who are doing the same work. And I think there are more and more fat positive, body positive communities out there that people can start to connect with and build stronger relationships there. And maybe in that way, leave more of the diet culture behind.
Yeah, this is such a tricky thing for me because I think I'll own that I kind of hate black and white stuff.
Yeah.
Like I struggle with the whole like purity, like boom, like you've actually left, like that,
Yes.
that just kind of like triggers a little stuff in me, and I'll own that. But it worries me on the level that I feel like people hold themselves up to the standard of like, well, if I've actually left, then I wouldn't have this thought, or I wouldn't engage in this behavior. And I feel like it's like adding so much shame onto like something we're trying to
pressure.
reduce. Yeah, and pressure that doesn't help outcomes.
Yeah.
But
well, and I also think it then puts you in a vulnerable spot that if you convince yourself I'm fully recovered, and don't do any more work. You're like, in some ways, I think this work is ongoing to continue to dismantle ways of thinking. I think if you define yourself as fully recovered, in some ways, you may be more susceptible to falling back in it because you're not doing maybe some of that work.
Yeah, that's really fascinating. I like that idea. Yeah, so I think this idea of actually leaving is really powerful and could really resonate with certain people. But I'm also imagining certain people kind of having that feel very very impossible or just so discouraging that then they're like, well, screw it, then I just won't try, So that's kind of where I am with that. I think that there's beautiful ways to opt out. And there's different things that we all can practice every day, that individually and in our communities and with our families, that we can opt out of diet culture and we can leave, in quotes, diet culture. But I think the risk with that is just making sure you're not holding yourself up to the standard of like, well, my litmus test for whether or not I'm actually at stage 5 is having 0 thoughts, 0 behaviors, 0, 0, 0. I just think that that's really problematic, and a lot of the people who struggle with these issues also struggle with perfectionism. They're motivated, they're driven, they're hard workers, they're earnest, they're just beautiful, lovely people. And so I think that that's just the thing I want to say about that is really try to exist somewhere in that gray area where it doesn't need to be this boom, I'm there moment,
Totally. Well, and I think in even exploring what the relationship was, whether to an abuser, to diet culture, because I think everything has a function. So if we're looking at it in a black or white way, like it's either all good or all bad, we might miss the opportunity to explore what was it that was appealing, because there are a lot of folks too in domestic violence who move from one abusive relationship to the next. Again, it's not their fault, but if we can build awareness around what maybe is attractive to me, in the same way with dieting, they move from one diet to the next, like from one juice cleanse to Weight Watchers to keto to whatever. So what is it that is serving them, and how can we maybe get that need served in a different way? But if we just put it all as it's all bad, we may not be able to explore some of the meaning behind it.
Oh, yes. Oh, that is such truth right there. I think, I think that's really powerful. I don't even know what else to add to that. That's great. So, go ahead. What were you wanting to say?
Well, I know we're sort of coming up to time, but, I just want to emphasize, and this is the same thing we emphasize in domestic violence communities. Community is so important. So finding other people who are doing this work, this is where I think groups can be so great, whether it's a Facebook group or whether it's a live, like a lot of us providers provide group counseling. Connecting with other people who are doing this work can help get rid of some of that feeling of, I'm just the crazy one, it's just me, and this is just my fault. You start to see, okay, I'm not the only one. There's other folks, and maybe I don't have to blame myself so much and feel like I'm so bad.
Yes, I totally agree. And the older I get, the more I realize stories and connection and community, this is what life is about. Being able to tell your own story, being able to listen to others' stories, connecting to stories from the past. Like, I think that that's so powerful to not feel like you're alone, you're the only one. I think that's such an important point. And also on the flip side, you know, I've said this a lot on the podcast, but the idea of taking a look at what you are, who and what you are surrounding yourself with can make a big difference as to whether or not you feel like you're in that state where you're like, yep, I'm actively leaving diet culture or choosing to opt out each day, versus kind of feeling like you're vacillating back and forth constantly and so confused. So taking a look at, you know, I say this all the time and I feel bad saying it again, but, you know, who are you following on social media? What are you clicking on in Facebook and on the news? Because you're going to get more of that if you keep clicking on the juice cleanse, the blah, blah, blah that you see. So just really trying to kind of fine-tune your virtual environment and then also your environment at home. And I know that that's not always as easy to kind of say unfriend, you know, in real life.
Right.
But you know, and sometimes that takes some work in therapy to talk about boundaries and to talk about how to navigate family members who just don't see things the way you do. But anyway, point is, take a look at that, because that's really important part of this process.
Yeah, totally. This was so fun to talk with you, Paige, and to explore this.
Yeah, I have had a great time, Maria. So tell us really quick how people can keep in touch with you, how people can access your website and social media and stuff, and then we'll say goodbye.
Sure. So the website is threebirdscounseling.com, and you can either spell out the word 3 or just put in the number, threebirdscounseling.com. And I'm on Instagram as Three Birds Counseling. I'm still on Facebook as Body Politics with Dr. Maria Paredes. And that's kind of where I started, was that name, Body Politics, because I think this work is very political and bodies have been so politicized. And I think, you know, in the same way that bodies have been oppressed, using our bodies is also the way out, you know, so becoming embodied, being at home in our body is the way out of oppression. And so that there's more to it, but that's sort of where that name comes from.
I love that. Yeah. All right. So I will link to your website, your Instagram and Facebook. And then if people want to reach out to you, I'm sure that would be great. You're in Greensboro, North Carolina. So if anyone's local, that's something to look into as well. Thanks so much, Maria, for being here. This was such a blast. I've loved talking to you.
You're welcome. I did too.
Well, I sincerely hope you've enjoyed this conversation. If you haven't already, please go ahead and leave a review on iTunes. Thanks again so much for listening, and we'll see you soon for another episode.